Healthcare reform has ignited much heated discussion in America. Why can almost everyone agree something needs to be done, yet no solution is proving acceptable to all sides? Tonight, the topics and issues that continue to confuse and complicate this national debate. What is fact and what is fiction? I'm Ernie Manous, and this is Houston 8.
A network-wide collaboration of PBS's trusted journalists.
Thursday night, PBS stations across the country spent 90 minutes of prime time providing a timely and much-needed in-depth look at healthcare reform in America and the latest government proposals to address this issue. Now examined how reform may change the way we live, especially for those who fall into the boomer category, who are not only concerned with their own coverage, but are also responsible for aging parents and grown children. Nightly Business Report investigated the serious and emotional issue of cost, especially in regard to employer-provided health care and new coverage requirements that many companies are adopting as a means of controlling health care. And Tavis Smiley focused on the childhood obesity epidemic, examining the causes and effects of obesity and the ways we can address this health care crisis. With all of this information and discussion, we need to ask, why are so many people still confused about health care reform? And what can we do to achieve a plan that will appease all Americans? Joining us tonight are Texas State Senator Dan Patrick, Dr. Nora Klein, Assistant Clinical Professor in Pediatrics, Baylor College of Medicine, and Dr. Catherine Peak, Assistant Vice President, University Health Initiatives at the University of Houston. Thank you all for joining us today.
Thank you.
My first question is, as we talk to people and we hear about health care in America, and we start every time we have this discussion, I start at the same point. It seems everybody wants something done. Yet why is everyone fighting? Why is there so much animosity in this? And I'll start with you, Dr. Peak.
Well, there are a number of valid issues on both sides of the equation. We know that healthcare is escalating. The cost is escalating to an enormous degree. We're all concerned about what this will do to status quo, what it may cost us on a personal level, and what it may cost us nationwide and for debt into the future. But I think the dialogue is healthy on both sides, and we welcome it, and let's get the ball rolling.
But beyond healthy, it seems like it's very personal. I'm going to go to Senator Patrick on this.
You said something, Ernie, it's interesting. Everyone wants something done, but everyone wants something different done. The poor want access to health care that they feel they may not have now, and better health care. People who have insurance don't want to give up their relationship with their doctors. So certain people have certain needs. Doctors and nurses are very skeptical of the system because of the pressure on doctors and nurses and the shortages we have now. In Texas, we're about 30,000 nurses short, for example, today. Then there's a question if you have a public option, which most people are against, according to the polls. People just don't want to lose their health plan. And I think the biggest thing, Ernie, is that while everyone knows there needs to be reform in certain areas, they really want to walk through this slowly. And there's a sense that in Washington they're trying to push it through quickly. Today, literally, the Senate, and yesterday the Senate, voted 12-11 against an amendment by Olympia Snowe, no conservative Republican. She's a very moderate from Maine. And she simply wanted the senators to read the bill before they voted on it and to post it online. And they voted that down 12-11. So they're going to vote on a bill in the Senate without reading it, without posting it online for 72 hours for the public to read it, and without a CBO number, the Congressional Budget Office number. How can you possibly vote on a bill and get confidence of the American people if you haven't even read a 1,000-page bill?
And that I snickered when you said it, and I don't mean to be light of it, but it blows my mind that people will not read the information that they're going on. But so many of us that are out there having this debate have not read this bill, have no idea really what's in it. And I'm going to go to Dr. Klein on this. There's a lot of these misconceptions out there that just continue.
Well, first of all, I believe it is not correct to say that most people don't want a public option. The last poll I saw, most people did want a public option. 63% of physicians would like single-payer care that is similar to Medicare, in fact, because it would make it so much simpler to bill. Right now, the billing situation in the doctor's offices is just a nightmare. So most physicians are not in favor of continuing the system as it is. as it currently is. I think that most people realize that there is an underlying contradiction in for-profit health care. So that if you buy your insurance from a company that is going to make a profit from it, they don't want you to get sick. Every time you get sick, they write this off as a medical loss, not as a benefit to their client.
Mm-hmm. Well, when
so
you talk about
there is a fundamental contradiction. We are trying to fix something that really isn't right at the very bottom.
I'm going to put a statistic out there just with what you're saying, that between 2000 and 2007, health insurance company profits have gone up 428%. When you hear numbers like that, how can you say, let's preserve the status quo?
It's not no one wants to preserve the status quo, and with all due respect, Doctor, I don't know where your polling numbers have come from, because I've seen no polling that says 63% of America wants a public option, or that the majority.
63% of physicians.
I have not seen any polling.
That was in a recent poll that was published in the New York Times.
Okay, well, I don't know where the questions were phrased, and I don't know where the polling came from. I will just tell you that let's take Memorial Hermann right here in our own backyard, for example. There was this move to buy that hospital. What did the doctors there say? If the county takes this over as a county hospital, most of us will quit. I think the majority of those doctors are saying, we don't want to be on a plan that Medicare, for example, like Medicare, that continues to pay us less and less and less for the services we provide. We are cutting our payments to doctors.
But my problem in this whole part of it is the word option. Right. It is not saying it is mandatory. It is just putting another option out there. Why is that not a good idea?
You know, Ernie, I think a part of the problem is the way we approach health care. There's a dichotomy of thought. Are we talking as health care as being an inalienable right of all residents, or is health care a commodity? Is it something that's marketed and we should be dealing with transparency of prices? And should I be shopping for health care like I'm shopping for a new car? Or is it something that has a higher moral premium to it? Is it something that we should be providing for all of our residents? And I think part of the problem with the confusion is that we mix the two approaches, and the dialogue it's a hybrid dialogue, and we need to step back sometime and think about what's the approach going to be? What's the more global approach, and then what's the nuts and bolts of addressing it?
Let me throw this out to all of you then. Can you fix our healthcare system? Can you improve it, I guess is a better way to put it, with what we currently have, or does it need to be torn down and rebuilt to get a serious, real healthcare initiative in this country? You
know, I think even talking about tearing it down and starting over shakes the foundations of what is real. We need to build on what we have. What the current system that exists now is based on a private provider system provided through employers. We've got to start there, and we've got to build on there and improve that system. Add other mandates if we can, or options, but that's the basis that we're going to start with.
Why? Why do we have to start there?
I think there's so much investment, so much investment in status quo. It's interesting to think about. Let's start over. Let's wipe the slates clean. Let's think about designing what the healthcare system could be to meet all of our needs and start over. But I don't think that's a pragmatic approach. And again, I go back to if we're approaching the dialogue as a moral imperative to provide healthcare services to all of our residents, or if it's a commodity.
And nowhere in the Constitution can I find that it is guaranteed. Not that we don't want to provide health care. And one of the arguments that concerns me is that people say, well, you can't get health care in America. Well, that's just a lie. You can be the poorest of the poor, and you can go into any emergency room and get the finest medical care in the world. You can go out there and have an accident and have no health insurance. And if we spend hundreds of thousands of dollars, taxpayers will pick up that tab in our neonatal unit at LBJ Hospital, or even at Texas Children, where more than 50% come in without health insurance, or in Corpus Christi, where 80% of the neonatals do not have health insurance. So it's a lie that people in America do not have health care. Is it inconvenient at times for people who don't have health insurance? Are there long waits in emergency rooms because that's their primary care? Yes. But this notion that people are denied health care in America, first of all, is a lie. The second thing, when you talked about why not a public option, Ernie, looping back to the question a moment ago, again, because they're rushing through the legislation, no one really knows, including myself, no one really knows what the final bill will look like or what even the current Senate bill is because it's not been posted. A 1,000-page bill, no one's even seen it. So I can't give you a precise answer, but I can tell you what I have read and what I have seen, and that is that the government will be competing with the private sector. I'm a small business owner as well as a state senator, and as a small business owner, if I'm going to be fined thousands of dollars, depending on what I offer or don't offer, whether I give it or I don't give it, I end up being forced into a public option. President Obama said the difference between a government option and private insurance is we don't have to make a profit. A for-profit insurance company can't compete with a company that doesn't have to make a profit. So it will close down the insurance companies. We will be forced into a public option, and all you have to do is look at VA care, Medicare and Medicaid and Social Security. The government has mismanaged and bankrupted all those systems, and we now want to turn over all of our health care to the government for all of us?
And I want to get deeper into that point in a minute, but I want to go to Dr. Klein.
Well, I want to read you the Constitution,
Sure.
all right?
Sure.
We the people, in order to form a more perfect union, establish justice, that's the court system, ensure domestic tranquility, that's the policing system, provide for the common defense, the armed forces, promote the general welfare.
Right.
What's that?
The general welfare could be all of the above. Show me where in the Constitution, Doctor. I don't want to argue the Constitution because I can do a very good job of that. But show me where it guarantees health care to every citizen.
It doesn't.
Okay.
But if
what it does is to set a tone that this is an obligation of government.
No, you are extrapolating your own meaning into the general welfare that it guarantees insurance to everyone. And what level of insurance?
No, I didn't say anything about insurance, but it guarantees the general welfare,
and, Doctor, we do
that
now.
includes health care.
And that's why we have public hospitals. That's why what I said a moment ago, that we take care of the poor.
That is true for children. Children get very good, and the poor, the very poor who have Medicaid, get excellent care. And I don't know what you mean by... What do you mean, thank you?
No, I mean, thank
pay
you for
it.
acknowledging that. Thank you for acknowledging that.
No,
I'm going to jump
it's a
in
very
here for 1
important
second
point.
and say, which
But
will probably ruffle some feathers here. In this conversation, I really don't care what the Constitution says. Where I'm coming from is that the president, who was elected and is our president, has said that we are going to do something about health care, and there are 3 points that must be addressed in whatever plan we adopt. And those are that the raising cost of health care must be brought down, that the freedom to keep or change whatever doctor or health care plan you're on, you will have, and third, all Americans must have quality, affordable health care. Those are the 3 points we have to work with.
But his legislation is not matching up with what he says,
right.
Ernie.
But what I'm saying is those are the whatever decision is made as a country as a whole, those are the criteria we must meet.
And I think a lot of people would agree on that. A lot of people would say we need to find a way to bring the cost. We don't have a health care crisis in America. We have a health cost crisis. Right. So we need to bring the cost down, and there are many ways we can do that. Secondly, we need to make it more affordable and accessible. And you can do that through the private sector more than the public sector. So, and we need to look at all those issues.
Yeah, I think I would take issue with that because I had the privilege of working for a very good insurance company for 15 years here. Yes. I was the head of pediatrics for Cigna.
Yes.
And we never made a profit. We were very moral and ethical. I think we provided great care. We took care of some patients, I won't go into the details, but who simply could not get insurance because they were, for whatever reason, patients I picked up through the hospital. Yeah. We didn't charge them, but we never made a profit.
Well, I think you said you disagree. I think I'm with you. I think in general, we need to bring the cost down of medicine, but I don't think the insurance companies are always the bad guy. Are there abuses? Have our premiums gone up significantly? Yes, but the insurance companies are not always the bad guys. Here's a number, Ernie, that we just have to deal with in terms of cost cutting. Tort reform. I would believe the government, I would believe the president, if he was serious about cutting costs, if there was national tort reform. There's no talk of it. And Howard Dean, who ran for president, head of the Democratic Party, said, of course there's no tort reform because we don't want to take on the trial lawyers. In Texas, when we passed tort reform in 2003, we used to have less than 2,000 doctors a year coming to Texas. We had counties that did not have doctors. We now have over 3,000 doctors coming here from all over the country because they can come here and practice. because I believe in doctors. I don't think we have to hold them to they're the only people, apparently, trial lawyers expect never to make a mistake. Obviously, people need to be protected from negligence. But doctors are trying to do the right job, and nurses are trying to do the right job. And when the president stands up and says doctors are doing extra tests to make extra money, I'm offended by that, because most doctors I know
is he saying that they're doing extra tests to make extra money, or are they doing extra tests on the fear that they will be sued for not covering any possible
that's what I say. They're doing extra tests to protect themselves from trial lawyers, but that's not what he said. He said that they're doing extra tests to make more money. The trial lawyers are the ones that are driving these tests. You want to take a big cut out of the cost? Then Mr. President, show us national tort reform. It's nowhere in the bill. He talks about, we'll consider a trial. Just copy what Texas is doing. We're doing it. Doctors, would you all agree that tort reform has made a difference in Texas?
And it's true that tort reform has brought more physicians to the state.
Yes.
They are settling mostly in the urban and suburban areas. They tend to be specialists and subspecialists. Sure. They've not had an impact on the rural communities, and I don't think the cost of medical malpractice insurance has changed significantly in the state. Of course, we're only, 5 years into the process.
Yeah, it's down.
It has changed.
Yeah. Is it down about 20%? 15
yes,
to 20%.
Yeah, okay.
So it's down about 15 to 20%. And yes, we don't have doctors in every rural county, but we have some rural counties that have 5,000 citizens. I mean, it's hard to get a doctor to go there. Right. But it's better than it was, particularly in the Valley area and some of the rural areas. Here's a number. Here are two numbers that should frighten everyone at this table and everyone watching. According to the Austin American Statesman, when we were in session, this last session, 8 people made 2,600 visits to the emergency room in Austin, Texas, costing the state of Texas taxpayers $300 million. We have a system that is out of control. Now, that's an anecdotal number, Ernie, but we've got to control the cost. In 2003, the state of Texas spent $35 billion on Medicaid. This year we'll spend in the next budget $60 billion. We've gone from $35 to $60 billion in 6 years. We can't it is going to crowd out everything else in our budget.
But part of the problem is that there isn't really very good supervision of what goes on in Medicaid.
I'm in total agreement. I passed legislation this session to monitor. It's called coordinated billing. We passed a bill in 2007 with Dr. Duell, Bob Duell, who's the only doctor in the Senate. And that bill wanted to verify when you filed for Medicaid, did you or did you not have insurance? The first year we found 90,000 Texans filed for Medicaid and they had health insurance. Why they did, I don't know. They didn't want to pay the copay. They didn't know it. We saved $62 million. Those are the kind of things, Ernie, that we have to do. Monitor what we spend. Tort reform, make health care more affordable. I passed legislation this session that allows drugstores, Walmart, those type of places to allow nurse practitioners and physician's assistants to give more care.
Watching, we sound like what a great agreeable group of people here.
Right, yeah. We could figure it out.
And I could go into the whole list of the myths that are out there about it, which was originally what we wanted to do in the direction we were going to go. Talk about the death panels and funding the illegal immigrants and all of that stuff. But hearing what we're talking about, the bigger question is, what can we realistically do? What can actually be a policy that we can all agree on? And I'm going to start with Dr. Peek on this. It takes us back to almost the beginning again.
Well, before we move on from the myths, I would like to challenge you, Senator, on your concerns about the burden that the undocumented residents might be placing on our emergency care system.
Okay. I haven't mentioned it yet today, but fire away.
Well, you were talking about the anecdotal evidence from Austin.
Well, those weren't undocumented citizens. Those are American citizens.
But, a lot of people do ask about the undocumented.
I recently read a report from the American College of Emergency Physicians who are saying that, in fact, about 88% of the patients that visit emergency centers do require immediate urgent care.
Yes.
So there's relatively little disuse of the system. The report also cited that the total cost of emergency care in the big picture of healthcare cost is only about 3%. And then I heard the director of the Harris County Hospital District, David Lopez, talk about the impact of undocumented residents on the cost of providing emergent care through Harris County Hospital District. And in fact, in 2008, Harris County Hospital District did provide emergent health care services to about 26,000 undocumented residents in the immediate area. And that amounted to about $150 million. But then Dr. Lopez looked at the figures and saw that this actually only accounted for about 12% of Harris County Hospital District's budget.
After the show, I'll be happy to go with you to LBJ Public Hospital over there, and we'll sit in the emergency room, and you count the number of people who speak English, and I'll count the number of people who don't, and it'll be much higher than 10 or 15%.
But again, getting to the point that Dr. Klein made, that what is the purpose of the Harris County Hospital District?
Well,
it is to provide a safety net. These people are residents. They do pay rent. Their rent is funneled into property taxes. Property taxes pay the Harris County Hospital District.
No one in this country doesn't want to take care of a sick child or a sick adult who comes to the emergency ward. I don't care if they're a tourist, if they're here illegally, or if they're a citizen. But I will also tell you, if you talk to Dr. Lopez, at LBJ Hospital, in the last reporting year, 81% of all the births in that hospital were to women here illegally.
Okay,
I'm not saying we shouldn't do it. I'm just saying
I think, and this is where the conversation gets lost.
The cost is 25% of our total budget.
I'm going to stop you there and say that illegal immigrants will get health insurance under this reform is not true. It's nowhere in the bill, and yet here we are talking about that area of it, and it's not even in
the
it.
Democrats voted down an amendment. There was an amendment proposed that would have said no health care to illegal aliens, and the Democrats voted that amendment down. So if you vote that amendment down, you don't have to spell it out that they will get health care, but if you vote an amendment down that says they will not get health care, why would you vote that amendment down? Secondly, here's the deal, Ernie. We have, and again, no one wants to deny service to people who are here. No one's going to say no. We're a compassionate country. We cannot continue to afford to taking care of the world.
Current national laws prohibit illegal immigrants from participating in government health care programs.
Yes.
That is current law.
Yes.
This does not change that. This also says in at least the House bill is that it does not say anything about illegal immigrants getting any government money to pay for health care. But it's a great hot-button issue, and people get riled up. And right now, if you're an illegal immigrant and you go into an emergency room, you will be taken care of.
Really
because we are humans, and we're not going to let anyone die.
We're going to ask them, show us your papers before we take care of your
we don't even ask citizens to show proof of insurance anymore if you go to the emergency room. You can't do that. Here's my point, Ernie. We're already taking care of illegals.
So then talking about it then is just a smokescreen. Because we're already doing it anyway.
Well, Ernie, thank you for making the point. My point is we're already doing it. So for the president to look in the camera and say, we are not going to take care of people here illegally is disingenuous at best.
It's
we already
will.
I would
will
like
not
to add that when we say that we're taking care of undocumented residents, that if we're restricting the conversation to emergency room treatment, then we're only treating the tip of the iceberg. People who come into the emergency room are in acute distress. It totally does not address the concerns about preventive care, about care for chronic problems like diabetes and heart disease and so forth. You don't get that kind of care in the emergency room.
And that's where health care for the poor falls apart, for chronic care. We probably have the best emergency rooms in the world. We probably do among the worst jobs in taking care of poor people who have chronic illnesses, diabetes, hypertension, etc. So that's one of the things that really needs to be looked
at. But doctor,
at.
We have increased...
And you can't really tell me that some day laborer is going to go sit in the emergency room and wait all day, sometimes 2 days, to get seen for his hypertension, be written a couple of prescriptions which he doesn't have the money to fill, come back in 2 weeks, the chart's not there, another doctor. That doesn't work.
Yeah, I'm not suggesting that, doctor. So I don't know what your solution to that is. But
my solution is health care for these people.
Okay. So you want to give free health care to every person, whether they're here or not?
No, I think that...
Legally?
I think that people could actually be charged something.
Dr. Klein, let me jump in and ask you this. If I am visiting Canada or Mexico or any other country and I am hurt and I go, or sick and I go to an emergency room, who is picking up the cost of that?
The government. I don't know about Mexico, but I know that in Canada and all over Europe, not only will you get treated in the emergency room, but they will not let you pay. You can say, look, I have insurance. I'll contact my insurance company, they'll pay. No, we don't do that. We don't want to bother with billing, with postage, with sending out, etc. They have no departments for charging people who come to the emergency room.
And if I understand correctly, too, you were recently at a seminar where they were looking at health care in other countries.
It was a different seminar, but it was in Argentina, and among the participants were people from Canada, from England, from Holland, from Israel, and they looked at us and they said, you know, you people are really crazy. What do you mean by bad-mouthing our healthcare system? It's really pretty darn good. Nobody goes bankrupt in Canada or England or wherever.
Yeah, they also live in some of these countries, and I was in Europe this summer studying the healthcare issue as well, where the tax rate is as high as 60%. And in health, and I spoke to a gentleman who spent 40 years in the British military. He has a bad hip, and he will not get a new hip unless it's life-threatening. So that's not the kind of healthcare America wants.
Right.
And let's get back to
I agree with you totally,
Yes.
and that's why we have all these examples to learn from.
Right.
We shouldn't be saying, oh, no. We should be saying, let's take a look at what works and what doesn't. And in that context, I want to recommend a book called The Healing of America. It's published by Penguin Press by a wonderfully intelligent fellow, T.R. Reid, who's been a journalist for many years, articulate. He lays out the case for his frozen shoulder in a variety of different countries that he went to.
And how they would respond.
And how they would respond.
And you know what they're telling me in my earpiece?
Yeah.
We are out of time.
You're kidding me.
There
We
goes
just
that
started.
half. I know. You're all going to come back and join us because I have a funny feeling this conversation will continue well after this show. Thank you all for coming
you.
in. Remember, each week we invite you to visit our home online at HoustonPBS.org. Simply click on the local programs bar, pick Houston 8, and you can join our online community. Read about the guests, learn more about the topics, and share your thoughts and ideas, and even suggest questions that we might ask during upcoming episodes. Remember, information posted on our website may be used on air, so keep that in mind when submitting. That does it for us tonight. Until next time, I'm Ernie Manous. Thanks for joining us. Have a great week.